Guys, I have discussion D for you. We're discussing historical plagues that changed medicine and society. Okay, so those are tonight's discussion. Here we go. Main idea. The page emphasizes that throughout history, plagues have not only devastated populations but also acted as catalyst for transformation. These outbreaks reshaped societies, altered cultural norms, and faced or forced medicine to evolve in response to cases that threatened human survival. How plagues affected medicine. Catalyst for innovation. Each major epidemic revealed the limits of existing medical knowledge. Compelling physicians and scholars to to experiment with new approaches. For example, the Black Death in the 14th century spurred early attempts at quarantine and inspired more systematic record keeping of symptoms and outcomes. Advances in medical practice. Plagues altered, accelerated the uh, personalization of medicine. Universities and hospitals began to formalize training while physicians sought more impractical methods to understand uh, contagion. Contagion. Birth, birth of modern epidemiology. Outbreaks like cholera in the 19th century led to breakthroughs in uh, tracking disease spread, laying the foundation for epidemiology and the scientific study of public health. How plagues affected public health and society. Sanitation and infrastructure. Epidemics highlighted the importance of clean water, waste disposal, and urban planning. Sites invested in sewer systems, or cities invested in sewer systems. Clean water and clean water supplies and better housing to reduce vulnerability. Collective responsibility. Plagues shifted cultural expectations, making health a shared societal concern rather than a purely individual matter. Governments began to enforce public health measures, from quarantines to vaccination campaigns. Social and cultural change. Beyond medicine, plagues reshaped economics, labor systems, and even art and region. The Black Death, for instance. Weakened federal structures in Europe and influenced cultural expressions of mortality and spirituality. Why those changes matter. The plague or the page underscores that humanity's resilience lies in its ability to adapt. Plagues, though tragic, forced societies to innovate and improve. They became turning points that advanced medical science, strengthened public health systems, and redefined social contacts. In this sense, the legacy of plagues is not only one of loss, but also of progress. Reminders that adversity can drive lasting transformation. Deeper reflection. Looking at these historical patterns, the message is clear. Medicine and society are intertwined. Epidemics reveal vulnerabilities, but also open pathways for reform, just as past plagues gave rise to sanitation systems, epidemiology, and modern medical institutions today. Today's pandemic continues to change or challenge us to rethink healthcare equity, global cooperation, and balance between individual freedom and collective safety. Explanation of plagues that shaped humanity or humanity, the diseases that nearly ended us, based primarily on the page you viewing. The article essentially a sweeping tour through the major infectious diseases that have shaped human history socially, medically, and politically. It's not just a list of pathogens, it's a narrative about how disease has rapidly forced humanity to adopt, innovate, and rethink how societies function. core theme. The central message is that plagues have been among the most powerful forces in human history, repeatedly threatening our survival while also driving breakthroughs in medicine, public health, and global cooperation. Each disease highlighted in the article represents a moment when humanity was pushed to the brink and changed because of it. What the page emphasizes plagues and plagues as turning points in medicine. The article shows how outbreaks led to major medical advances, smallpox, global vaccination campaigns, and first eradication of human disease, cholera, modern epidemiology, thanks to John Snow's water source investigation. Yellow fever and malaria, breakthroughs in vector-borne disease research, polio, mass immunization strategies that reshaped public health. These diseases forced scientists to understand transmission, immunity, sanitation, and prevention in new ways. Plagues as social and political forces. Many of these diseases described reshaped societies. The Black Death devastated Europe, collapsing federal systems and transforming labor markets. Typhus and dysentery repeatedly changed the outcomes of wars. HIV and AIDS reshaped global health policy, stigma, conversations, and biomedical research. COVID 19 altered daily life, work, and global systems in real time. The article underscores that disease is never just biological, it's deeply social, persistent inequities. A reoccurring theme is that poverty, poor sanitation, and weak infrastructure make certain communities far more vulnerable. Malaria, less Leishmaniasis, Leishmaniasis, uh, sclerotomas, and hookworm disproportionately affected low-income regions. Diseases like typhoid, cholera, and hepatitis A flourished where clean water is scarce. Many forgotten diseases persist because affected populations lack political power or resources. The highlights, the page highlights how disease burden mirrors global inequity, the ongoing threat, even though many of these diseases are ancient. The article stresses that some are reoccurring due to vaccine hesitancy, measles, mumps, whooping cough. Others are evolving drug resistance, TB, typhoid, and gonorrhea. Climate change and global travel are expanding the reach of mosquito mosquito-borne diseases. The message is clear. These plagues aren't just historical, they're active threats. Why this matters. The article closes by arguing that the lessons from these diseases, prevention, rapid response, sanitation, vaccination, and global cooperation are essential for facing future pandemics. It's a reminder that humanity's survival has always depended on learning from past outbreaks and strengthening public health systems. If you want, I can turn this into a podcast segment, a thematic outline, or a comparative framework for your work on aging, meaning making, or public health storytelling. Okay, guys, that is your C. I will try and do D later, but for now, Gator Wellness, take care, folks. And like I always say, when we do lives, you all can leave me comments about shows I've done, about the evening shows I do for you. Then we will see if I have enough information to do additional shows on that subject. So for now, Gator Wellness, take care, folks.